Good morning, ladies and gentlemen. Welcome to Texas Health and Science University. My name is Lin Ying Tan. I'm the professor and clinic director of Texas Health and Science University. First of all, I announce this video is for the training purpose. It's not a real CNT class. So today we're going to have the clean needle technique class. So welcome everyone here and then introduce our school. In this facility we have 4 bathrooms and then 2 exits. So if any emergency happens, please contact me. I will show you how to deal with those emergency issues. Okay? And then we assume you already studied the clinical technique manual 7th edition already. And then here are the schedules for today's class. First of all, we're going to have lectures, and then we have a 5 to 10 minutes break. After the break, I will give you a demonstration of clean needle technique. After the demonstration, we will have written exam immediately. We will not have any breaks. So after the exam, we will grade you right away. So every student just have one-time chance. If you fail the written exam, you fail the course. So don't be very careful about your test. Okay? After the test, there's somebody else. We have examiners, administrators. They will show you where you can go to take your next step exam, practical exam. Okay? At the practical exam, you have twice. So if you fail, the first one is not, I want to, so I hope you can pass the first time. But if you fail the first time, you have another chance to retake it. Okay, after you pass all the exam, you finish your evaluation, and then take your evaluation, you can go home and then have a very good day. Okay. So let me give you a brief introduction of the CNT course first. So the CNT course is originally developed by NCCAOM in 1984. But after that, in 1989, CCAOM agreed to undertake the administration of nationally standardized CNT course. So the students will ask, we learn a lot in the school. Why we need the certification from CCAOM? Why we have to have another course called the CNT class? So the purpose of our class is to promote the public health and safety, to help protect the well-being of acupuncturists as well as their patients, employees, and then the general public. And then to maintain the public confidence in our profession through the promotion of consistently higher national standards for the clinical procedure. And then the goal of our class to ensure that acupuncturists master the knowledge and skill required to perform acupuncture treatments as a clean and safe procedure. And then to inculcate the appropriate attitude with regard to the implementation of clean procedure in clinical practice. So that's the goals of our class. And then at the same time, the CNT certification is required by the licensing medical board of every state, and then the AOM institutions, hospitals, medical and clinics, insurance companies. So that's why the school, you have the classes in the school, and then the CCAOM give you the certification. Okay? And then next, I will introduce the outline of our lecture today. So that includes 5 parts. The first part is introduction of the minimizing method of adverse event. And then the second one is clean needle technique. And then the third one is healthcare associated infections. And then the fourth one, practitioner and practice cleanliness. And then the fifth one, legal requirements. Our training video focus on the minimizing adverse events. So the students maybe have questions. what kind of adverse event is caused by the acupuncture? Because the students will say, oh, I go to the traditional Chinese medical school because we know the acupuncture is no side effect, no adverse effect. But this is right or wrong? Yes, this is wrong because acupuncture is one kind of method will intrude the skins, definitely will cause adverse effect. That's not anybody, no one wants adverse effect. So that's why here we teach you the skills of minimizing the adverse event. So first of all, we need to know what event cause adverse event. Okay, first of all, low risk, few complications event like needle sign pain and tightness, bleeding, bruising. And the uncommon one are thickness, stuck needle, nerve injury, needles not removed, pneumothorax, and local infection. So I will introduce how to minimize insertion pain, because when the patient they feel pain when you insert the needle, they don't like it. They don't like your treatment at all. We have this case in the clinic. So after the patient have the treatment, the patient said, oh, today the intern was awful. It's very, very painful. I don't want to make any appointment with the intern anymore. So, minimize the insertion pain is very important. So how to avoid the insertion of pain? First of all, we need to understand the precise location of points. Avoid the superficial arteries and veins, first of all. And then, after you wrap the location of points, you need to wait the alcohol dry. After it dry, we palpate the location of points, and then we insert the needle. Especially, we will take very special care for the scalp and ear points because they are sensitive. Underneath the points, there are very little subtle arteries and veins and nerves. So let me summarize for you the procedures, how to avoid, minimize adverse event. First of all, we clean our hands by the water, soap, or hand sanitizer. And then until it dry, we use alcohol pad to swab the location you want to insert the needles. And then we palpate the points for a little bit, wait until the alcohol dry, so we insert the needles. So that's the procedures of how to avoid adverse event of insertion pain. Next one is the bleeding. So some students found out after the needle removed, the patient will have bleeding. The patient will feel like, oh, this is unpleasant experience. They don't want bleeding. So how can we avoid the bleeding for patients? First of all, when you're taking the patient, you need to ask the patient medical history, like what kind of medication they took, and then what kind of previous medical history had, like the hemophilia, diabetes, or any medication they took will thin the blood. If they have this disease, we have to be very, very careful about the patient. Okay, and then we palpate the points first. Avoid the superficial arteries and veins. Don't directly insert your needles to the arteries and veins. After that, we put needles in, and then when you remove the needle, so we press the points for a while. After that, we check the cotton ball has blood or not. Okay, so that's it. Thank you very much.